Okay, welcome back, everybody. This will be your video lecture for Chapter 32, Toxicology or Toxicologic Emergencies. All right. So let me introduce the chapter to you. Exposure to toxins, accidental and intentional, is a common reason for emergency medical care. The majority of the toxin exposures unintentional, intentional poisons, majority of suicide attempts, and poison deaths. Intentional exposure, abuse, or misuse of substances, mechanisms of intentionally harming another person. The unintentional exposures, accidental exposures, therapeutic errors, occupational environmental exposures. We're going to talk more about ingestions of toxins. It's the most common route for both fatal and non-fatal exposures. A fatal exposure, sedatives, hypnotics, opioids, cardiovascular drugs, the list goes on. And then the pediatric population, analgesic, batteries, hydrocarbons, plant, cough, and cold preparations. So what is toxicology? Toxicology is the study of prescription and illegal drugs and plant, animal, and other toxins. Toxidromes are categories of toxic substances. We're talking about the roots of the toxins, right? Because it could be ingested, inhalation, surface absorption, or injection. And we could all give examples, probably at this point in time, of calls we ran that involved an example of all of these. So ingested substances, they're going to enter the body by being swallowed. So that includes, plants, medications, alcohol, household substances, anything that people can ingest, a fentanyl patch, right, can be ingested. Substances absorbed from gastrointestinal tract where they reach the stomach and small intestines. The inhaled toxins can be fumes and gases that causes tissue damage with contact. Surface absorption caused by damage directly to the skin and mucous membranes. Injections, toxins that are injected, sub-Q or intramuscular, right? And that could include bites, stings, or even IV drugs. And toxins can have a number of effects, and it depends on their nature. Some primarily local, causing irritation of exposed tissues, but others can have some profound effects on certain body functions. So we need to know that when we're facing these types of calls, we can reach out to the Poison Control Center. And if you have your protocols downloaded on your phone, you'll actually have that contact number to the Georgia Poison Control Center. So it depends, right? We're assessing management toxins, but it depends on what the toxicological emergency is, right? We're going to do a good scene size up. We're going to try to identify those hazards early. We're going to make sure that we have our own appropriate PPE on. We're going to, a lot of times that these calls can affect more than one person. You may have more than one patient, right? And I'm showing a picture of like a train car with some firefighters doing a little training, it looks like. So what type of resources might you need? Well, you might need the fire department. We might need Hazmat 19 to come out, right? Law enforcement, if we had to evacuate a scene or evacuate people, close roads, we're going to need their help. And yeah. So intentional poisons, overdoses, substance abuse, they usually go hand in hand with increased risk for violent behavior. So we need to be aware of that and take the appropriate precautions. Once we do identify that we're dealing with a toxic emergency, we're going to need some information. The name of the substance would be good. Then the quantity would be good. Time of exposure. When did this happen? the patient's weight, and what's been attempted in treatment so far prior to your arrival, if anything. What's the duration of the exposure if it's relevant, right? If they took something, may not be relevant, but if they've been huffing paint for an hour, might be relevant. The labeled information, if it's in a transport container, if there's a DOT guide number, that would be great. And identify the potential for polysubstance or overdoses, meaning, you know, is there other drugs involved besides this one? That comes into play, like for your elderly patients that may have taken too much medicine and they're taking a beta blocker along with it, etc. Obviously, we're going to pay attention to our ABCs. We're going to, you know, all this assessment stuff, I know you guys know, but we're going to make sure we do ABCs. We're going to assess for shock, etc. Get a good sample history. We're going to look for clues around the scene, right? They say many patients who attempt suicide do so with mixed methods. And so we have to be aware of that it could be a danger to us. So what's our treatment? Well, our treatment, if it's a narcotic type overdose, is pretty simple for us. We have two choices. We could come along with Narcan and we could give that intranasally, or we can establish an IV and we can administer 2 milligrams IV. That's for, you know, narcotic overdose. We're going to make sure that we're managing that airway. In the case that, you know, this is a really bad high potency type fentanyl out there, you know, it may not respond to 2, 4, even 6 milligrams of Narcan, right? So we may be managing that airway for a little while. In this case, this patient I'm showing a picture of was exposed to a toxin. And our number one thing is try to get them away from that scene, right? Carbon monoxide, we should be familiar with this, considering our job. It's a colorless and odorless gas created during the incomplete combustion of fuels, right? And it's dangerous, obviously, in enclosed spaces like residents. It's quickly absorbed across the respiratory membrane, where it binds readily with hemoglobin. I always said that carbon monoxide was hemoglobin's first love. And took oxygen because it broke up with hemoglobin, because it broke up with carbon monoxide. And it really, really loved carbon monoxide. So signs and symptoms: headache is like your number one. Dizziness, altered mental status, and along with all the other vomiting, tachycardia, etc. They're saying signs and symptoms of severe poisoning can include chest pain, confusion, seizures, unconsciousness, rhabdo, renal failure. All of that can occur with prolonged exposure. So how do we treat it? Well, we want to treat it with high flow O2. If we need to try to transport to a facility that has hyperbaric chamber, IV fluid administration. If they're hypotensive, we're going to do a fluid bolus, 20 milligrams per kilogram, and a 12-lead EKG. Here's Captain Pitt's new love, cyanide. He loves him some cyanide. He loves him the cyano kit. It's found in several products. It prevents its prevalent route is home fires. Often occurs with carbon monoxide poisoning. Seems like to me that they're called the toxic twins. This is a cellular asphyxiant, right? So it just strangles the cell. It stops energy production. It's going to stop the mitochondria. That's why they say it stops energy production, because the energy is created in the mitochondria. Death can occur in seconds to minutes, or even an hour. And your cyanide poison are what? Same as your carbon monoxide poisons. Same signs and symptoms. So we do have the cyano kit as a treatment. There's other sodium nitrate and sodium nitrate injections, but we have the cyano kit. Caustic substances like acids and alkalis cause chemical burns when in contact with the body. Household cleaning agents can be acidics or they can be strong alkalis. And they're often ingested in suicides, even though I've been doing it for 24 years. I've never ran a single call where somebody tried to do that. But, you know, I'm sure it happens. Just haven't worked in an area where it does. If ingested, acids and alkalis can result in erosion of the esophagus and stomach, hemorrhage, and cause severe pain. You never want to induce vomiting if you think they've ingested a caustic substance. So you're going to have some signs and symptoms of caustic substances. Burns around the mouth would be number one to look for. A hoarseness, stridor, difficulty in breathing. You want to remove contaminated clothing and jewelry as quick as you can. Flush the skin and eyes with copious amounts of water. And it says use water only. Hydrocarbons such as gasoline, butane, kerosene, lamp oils, mineral oils. They're found, you know where they're found. I don't need to go into that. And the exposure could be any route. You could have cardiovascular hypotension, sudden cardiac arrest. It could be GI upset. That's what I hate about toxicology. It could go from your left pinky can hurt all the way to you're dead. There's so much that they put on here, but it could be just about any sign or symptom. Huffing is a deliberate inhalation of hydrocarbons for the purpose of intoxication. So yeah, wheezing, tachypneic, shortness of breath, hypotension. They say sudden sniffing death syndrome. I'm showing a picture of a guy who has to be dead from sudden sniffing syndrome. He's been huffing a paint out of a Ziploc bag, and he's got this yellow paint surrounding his nose and his mouth. He looks like he's had a good time. Organophosphates are found in pesticides, and they can be a weapon of terrorism. The exposure, inhalation, absorption, ingestion. They're potent chlorogenics, and use the sludge acronym for remembering the effects of organic phosphate poisonings. Hang on. Muscle twitching, paralysis, seizures, altered mental status, bradycardia, all of it. Avoid exposure, right? We need hazmat there to decon that scene. For sure. For sure. Airway management complicated by copious bronchial and oral secretions. So you're going to need to have your suction ready. And antidote kits are carried by advanced EMTs. They include atropine and paralidoxamy. But I don't know if we still carry those or not. We used to carry them a while back. Ethanol and toxic alcohols. So ethanol, beverage alcohol. Culturally accepted intoxicating substance. It's a CNS depressant. Slurred speech. You know what somebody who's intoxicated looks like. Do not assume only problem is alcohol intoxication, right? And that's where, in this job, that's where we always get in trouble. We assume somebody is what? Just drunk, right? And then the next day they're dead. Never, ever assume it's just alcohol. It could be diabetics. Hypoglycemia can look like someone's intoxicated. And then when somebody's also intoxicated, they could have had other drugs on board. So we don't know at the end of the day. So you got to be careful if you have someone who's, showing signs of alcohol intoxication, that's the only problem. You need to make sure of that. And a transport to the hospital might be the only way to do it. Ethanol and toxic alcohols continue here. Detrimental effects to the body of long-term abuse. Wernicke-Korsakoff syndrome, which is alcohol-related psychosis. Combination of thiamine deficiency and permanent neurological damage. Amnesia and confabulation. Cardiomyopathy, hypertension, high cholesterol, pancreatitis, which is problems with alcoholics. And it's painful, and it's really painful. Cirrhosis, stomach cancer, decreased blood clotting factors. So one part of alcoholics, they deal with DTs. 2 to 3 days following cessation of alcohol with a history of dependence, and the mortality rate is 5 to 15%, which, I wouldn't think it would be that high, but it is. Tachycardia, hypertension, sweating, delusions, and visual, auditory, tactile hallucinations. Sudden alcohol withdrawal may precipitate seizures 6 to 48 hours from the last time they drank. So look, if you go to the call, it involves an alcoholic who's went cold turkey is what we call it. They just stopped drinking. Please transport them, because they're going to need help. They're going to need Ativan and a few other drugs. A lot of times these patients' electrolytes are really messed up, so they need to be assessed in the ER. It's no joke. DTs are a really bad deal. Methanol, or wood alcohol, is used in commercial products. It's illegally produced alcohol drinks. Patients exposed to methanol can suffer blindness or blurred or cloudy vision, abdominal pain, altered mental status, and rapid respiratory rate. Manage them as symptoms present. Isopropyl alcohol or rubbing alcohol, widely distributed exposure is high. Altered mental status, ataxia, they have slurred speech, abnormal behavior. Twice as drunk, twice as sick, twice as long. I like that. Patients can present with abdominal pain, GI bleeding. Ethylene glycol is an ingredient in vehicle radiator antifreeze. And so a lot of wives like to poison their husbands this way. Lethal in small amounts and sweet tasting. It tastes so good. The neurological changes, unconscious, ataxia, slurred speech, seizures, tachypnea, tachycardia, blah, 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 and some more blah, but you get it, right? Manage the airway like you always will and anticipate vomiting. Treat the hypotension should you need to. Fluid bolus. Food toxins and plants. We have botulism, some seafood, toxin. What is that? Sigua toxin. Seldom fatal abdominal pain. Okay. Neurological symptoms. Whatever. Histamine fish poisoning. There's you one. Formerly called, so it's so common we had to change the name. Formerly called scombroid fish poisoning. Wow. Signs and symptoms that mimics allergic reaction. It's hypotension, bronchial spasms, and angioedema. Affected fish can have off flavor. It's awesome. I don't know how you would treat that. It was going to tell me, I think. Histamine fish poison, assesses, manage breathing, circulation. Minister IV fluids for hypotension. Going to nebulize some beta 2. Remember, beta 1, 1 heart, beta 2, 2 lungs. So we're going to do albuterol. And you do treat it just like any other anaphylactic reaction. So we have plant toxins, right? And you can find these on the roadside in fields. Jemison weed. Smoke or drunk as tea. It's potent anti-chlorogenic effects. I think about that guy that they did that movie on, the guy that was living in Alaska on the land, and he got those berries and made him so sick, and he died out there. That's crazy. But every time I think about poisonous plants, I think about that guy. He mixed his berries up, apparently. You know what movie I'm talking about. Or you know that it's a true life story, so you know what I'm talking about. And that's a bad day. That would be a bad way to die. And so there's a table of some food and plant toxins for you there. Mushrooms. Let's see. You know, they cause all the same signs and symptoms. And so I assume you just treat them the same way. Treat the symptoms. And then now we talk about venom, and we talk about snake bites and spider bites. And this is the brown recluse spider. And if it bites you, it can cause tissue necrosis. And it's bad. You got to take it to the hospital. Here's a picture of what it looks like. Then you got the good old black widow spider and scorpions. Then you got the neurotoxin here. It's painful spasms in large muscles, nausea, vomiting, diaphoresis, seizures, paralysis, altered mental status. They don't call her Black Widow for no reason. There's a picture of that beautiful spider. They're common here in the southwestern states. Snakes. You got rattlesnakes, water moccasins, and copperheads. Here's a picture of them, and talks about don't use ice and don't use a constricting band. And don't try to suck the poison out. Do not elevate the extremity. Manage airway breathing, apply oxygen, establish an IV access, transport to a facility that can rapidly obtain antivenom, which I think all ERs can. I think so anyway. That's going to go for all your venomous snake bites. We'll back up here. Antihistamines have anti-chlorogenic properties, so they can present with dry mouth and thirst, blurred vision, tachycardia, hypothermia. They have iron toxicity, which is probably a bad day because your body uses iron and hemoglobin. Systemically, iron interferes with cellular energy production, metabolic acidosis, liver, heart, kidney, lungs, and severe damage. Benzodiazepines, they're like muscle relaxers. And then, of course, you have narcotics like, hydrocodone, morphine, all those. Lithium is used in bipolar disorder as a mood stabilizer. Toxicity can occur easily. And that's true. If you come into the ER, we're going to check your lithium level to see where you're at. Got to be careful with this cardiac medication toxicity, especially like with beta blockers. If you take too many beta blockers, it's blocking beta. So instead of seeing like a tachyrhythm, you're going to see bradycardia. If you have a slow pulse rate, you're going to have a low blood pressure because Cardiac output, which is blood pressure, is heart rate times stroke volume. So if I want to affect the blood pressure, I want blood pressure to go up, I want heart rate to go up. If I want blood pressure to go down, I want the heart rate to go down. Calcium channel blockers treat hypertension, so they can also cause the same symptoms. So you're going to treat the symptoms. Then we have stimulants like cocaine. And so their effects are relatively short active, but increase in dopamine at the synapse, causing users to feel euphoric and energetic and alert. Both appetite and need for sleep are decreased. It's a big vasoconstrictor, and that's the problem. They say cocaine's a hell of a drug, and it is, especially when it makes your coronary arteries vasoconstrict and you have a heart attack. So that's the big problem. That's when you have like a 23-year-old who's complaining of chest pain and you put them on the monitor, it shows STEMI. A lot of those are cocaine-induced heart attacks. I'm not going to cover all these because I'm not going to waste your time in covering all these because you've covered them in EMT school. You're familiar with a lot of these drugs for being out there. I'm just not going to do that. But GHB, I haven't seen that in a while. I think it used to be a big deal. They used to sell GHB at the nutrition stores. But I don't think they sell it like that anymore. So you don't have to worry about that. Ketamine, that's a great drug. Special K, vitamin K, dissociative anesthetic, sense of disassociation. If we carry ketamine here at the county, and it works really well. Unless you're abusing it. I guess it wouldn't work well at all. That's it, y'all. I'm going to put this out there. You guys just read the chapter, look over it, familiarize yourself with it. It's more of a review for you for the A class than it is new material. Hope you're having a great day. We'll see you soon.